All right, welcome, welcome, welcome. It's been so long, everybody. It's been so long. You see, it's 2022. The last time that we all got together for something like this is 2019. And I'm going to tell you something. Those 3 years in between, things have changed tremendously in our area. And never before have we been needed as much as we are needed tonight. So I want to welcome you to the Affinia Healthcare Foundation's Starburst Gala, Endless Vision. Now, we chose this theme because it truly embodies the goals and the objectives of the foundation and our aspirations for those that the foundation serves in the St. Louis community. One of the largest and most diverse community health centers in Missouri, Affinia Healthcare provides medical, dental, behavioral health, and enabling services to St. Louis's underserved populations and communities in our area. And your support makes the work that Affinia Healthcare is doing all the more possible. Now, throughout the evening, you will have multiple opportunities to support the Affinia Healthcare Foundation. And just by being here tonight, you're already showing your support, your endless vision. And we thank you so much for that. Now, if you did not purchase a raffle ticket with your virtual gala ticket, or if you want to purchase additional raffle tickets, we're okay with that. There is still time to make that purchase possible. If you, in your program, you can preview the items that are available for raffle. Now, if you would like to purchase tickets, we are posting a link in the chat window for you right now. You can also find this link inside of your program. Go ahead, find that link, buy some tickets. Now, I also want to warn you that you don't want to miss out on the golden ticket raffle, where you could win 1 week vacation in Nuevo Vallarta, Mexico. A limited number of tickets will be sold tonight. So you get your tickets while supplies last, and hopefully you inch closer to be going on that big trip to Mexico, and also helping us reach our fundraising goal for this evening. The winner will be announced at the end of the evening, by the way, so stay with us. Raffle sales will conclude at 6:15 tonight, so I wish you all the very best of luck. Once again, welcome, 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 and thank you so much for being here. We appreciate your commitment to Affinia Healthcare and the Affinia Healthcare Foundation. It is now my pleasure to introduce to you and welcome to the podium the Executive Vice President of the Affinia Healthcare Foundation, the one, the only, Mrs. Yvonne Bullinger. She's going to say a few words. Yvonne?
Good evening. On behalf of the Affinia Healthcare Foundation, I welcome each of you to our Starburst Gala. This evening, you will experience something unique and I hope informative, but most of all, inspiring. Tonight's Masters of Ceremonies is Mr. Renny Knott of KSTK News and great supporter of our mission. Thank you, Renny. Mr. Knott will be guiding us through the many exciting features of our gala, which include keynote speakers, video presentations, fabulous raffles, and other opportunities to give in support of our mission. Many of you have been anticipating attending our Starburst Gala for the past 2 years now, as the COVID-19 pandemic made it necessary for us to reschedule this special event. Today, we finally gather in this virtual format with a great hope that finally we are near the end of the terrible toll that COVID-19 has inflicted onto the communities we serve, our lives, and the world. We thank you again for your support in joining us this evening. Our mission can only be as impactful as our supporters, you and all of our donors. Affinia Healthcare Foundation's mission is to secure the financial resources needed to address unmet healthcare needs in our community by supporting the strategic initiatives of Affinia Healthcare, our community health center. I want to express my deepest gratitude to our stellar board of directors for their dedication to a legacy of healthier lives for those most vulnerable in our community, that together with each of our donors, we strive to build. The location from which we bring our Starburst Gala to you this evening is the Urban League's Peter Bunce Campus Gym, the site from which Affinia Healthcare currently offers the life-saving monoclonal antibody infusion therapy for COVID-19, as well as one of our COVID-19 testing sites. We chose this setting as the services offered here are representative of the extraordinary efforts and life-changing work of Affinia Healthcare, serving vulnerable individuals and otherwise underserved and under-resourced communities. The theme of our Starburst Gala this year is Endless Vision, as we do not place a finite possibility on the impact of our work to address the unmet healthcare needs of our community. With this endless vision in mind, we look beyond now and into the future, where there are no more healthcare disparities disproportionately impacting the lives of the vulnerable individuals served by Affinia Healthcare. No more babies born underweight, starting life struggling to thrive. No more children impacted by asthma without the treatment they need, struggling just to take a breath in their daily lives. No more fathers, teens, or anyone else walking with untreated dental pain and oral health conditions that impact their overall health and dignity. No more people too young, too dear, to experience disabling impacts of undiagnosed, uncontrolled, or untreated chronic illnesses such as diabetes, cardiovascular disease, and cancer. No more people suffering or dying for lack of access to the help they need for mental health or substance use treatment needs. No more preventable and treatable issues causing undue suffering in our communities. No more. That is our endless vision, for which we rely upon each of you to carry forward and help transform the communities we serve into healthier communities. I invite you to hold in mind the vision of a happy mother who holds a healthy baby because of you and your support. A busy child letting their creativity shine in school because they can breathe easily because of you and your support. A young man proudly walking on his first day at work, smiling brightly with no dental pain because of you. A grandmother who wipes tears of joy as she hugs the granddaughter who no longer struggles with substance use because of you. Do not let me stop you in seeing this endless vision of what healthy lives look like, because that is what we are going for tonight. The sky is not the limit, the firmament is infinite, and so is our vision.
Now, you will notice that the welcome from Yvonne, as well as two of our speakers tonight that will be coming up, all take place from a different location. It's Affinia Healthcare's COVID-19 monoclonal antibody infusion therapy center located at the Urban Leagues campus on Bissell Street. Patients in vulnerable St. Louis communities have limited access to this very important treatment. Affinia Healthcare is honored to be invited by our state and city health departments and the Departments of Senior Services to support and provide this service and to offer the service at a valued community location operated by the Urban League of Metropolitan St. Louis. On August 31st of 2021, Affinia Healthcare partnered with the Missouri Department of Health and Senior Services and the City of St. Louis Department of Health to help provide monoclonal antibody infusion therapy for COVID-19 patients in the St. Louis region. The partnership with the City of St. Louis Department of Health continues as need persists. This treatment is prescribed for patients who have mild to moderate symptoms of COVID-19 and an elevated risk of complications. Data from clinical trials show that high-risk patients treated with monoclonal antibodies had a 70% reduction in relative risk of progression to severe disease or hospitalization compared to patients who did not receive monoclonal antibodies. Since January of this year, Affinia Healthcare has begun to offer oral treatments for COVID-19. Having these treatments available in North St. Louis, where we have seen some of the highest rates of COVID-19 transmission, has been critical. This location helps Affinia Healthcare bring equitable access to this life-saving treatment without burdening families with having to travel far from home to get the treatments. Affinia Healthcare, together with their partners, remain dedicated to addressing health inequalities and partnering with organizations who have an endless vision for St. Louis. That gets us one step closer to an equitable community achieving optimal health for everybody. Your support tonight allows us to continue this important work and supports the Endless Vision. Affinia Healthcare and its partners have for St. Louis as an equitable community, achieving optimal health for everybody out there, no one left behind. Now, here to tell you more about our Endless Vision is the Executive Vice President of Affinia Healthcare, Dr. Kendra Holmes. Doctor?
I am grateful that you have chosen to join us in support of our mission. At Affinia Healthcare, addressing the healthcare needs that disproportionately impact the communities we serve are among our primary objectives, such as working to decrease premature births, deaths due to opioid use disorders, lack of dental care access, and high rates of chronic illnesses. In addition, over the past 2 years, we have focused a lot of our efforts on protecting the community from the threat of COVID-19. The risk being highest for the elderly and the immunocompromised. COVID-19, like most other health issues, had a disproportionate impact on the poor, on Black and brown communities, and on other marginalized and vulnerable individuals. Because of our awareness of the persistent socioeconomic barriers in the communities we serve, we knew we needed to act swiftly when the COVID-19 health emergency was declared in our region, in order to ensure that COVID-19 testing would be accessible in the under-resourced communities we serve and for those most at risk. And so we did. Since April 2nd, 2020, Affinia Healthcare has worked tirelessly providing COVID-19 testing at numerous locations in the most impacted areas of the St. Louis region, in collaboration with multiple community partners. As of today, Affinia Healthcare has provided over 34,800 COVID-19 tests. Also, today, as we hold the Starburst Gala, you may note that this is also the second anniversary of Affinia Healthcare's provision of COVID-19 testing in the St. Louis region. Then, in January of last year, as soon as the COVID-19 vaccine became available, we began providing vaccine. As of today, we have provided over 24,900 COVID-19 vaccines since September 2021. Affinia Healthcare has been the only non-hospital setting in St. Louis where monoclonal antibody therapy for COVID-19 is provided. Most recently, on January 19, 2020, Affinia Healthcare received its first shipment of nalpiravir, an oral viral treatment against COVID-19, which has proven to be very effective against the Omicron variant of this virus. The COVID-19 health emergency has posed additional barriers to healthcare access due to the negative impact on income for non-essential workers, low access to support systems like daycare and schools, and increased transportation challenges. To counteract these challenges, Affinia Healthcare significantly increased its telehealth services for medical and behavioral health visits, implemented curbside pickup for prescriptions, and established in-car medical urgent care services, including lab tests and screenings. Many of these approaches will continue to be in place beyond this pandemic, as they are also very helpful in breaking barriers to healthcare faced by our patients before the pandemic and which continues to exist today. As the COVID-19 pandemic is waning, we continue to work to meet the healthcare needs of the most vulnerable in our community and all who seek excellent quality of care while providing compassionate, trauma-informed, and culturally competent care in the communities we serve.
Thank you, Doctor. Folks, were you dialed in for that? Were you dialed in? Did you hear the many ways in which your support is helping to make a difference right here in our community? Together, we are breaking barriers, and because of you, the vulnerable and underserved population of our community has access to some excellent quality care. That's huge, my friends. That is huge. That is what you call an endless vision. Our final speaker tonight is Dr. Alan Freeman. Dr. Freeman is the president and CEO of Affinia Healthcare. Please join me in welcoming him in right now. Alan?
Good evening, everyone, and welcome to the Affinia Healthcare Foundation's Starburst Gala. I'm Dr. Alan Freeman, President and CEO. We are incredibly thankful for your presence tonight. Today is a great day, a day when we feel and can experience in significant ways your support and your caring concern for people all across our region. Those who face enormous challenges in their lives that result in lack of access to healthcare services, and poor health outcomes, and the existence of inequitable health disparities. This is a day when we feel hope that both the COVID-19 pandemic will soon be behind us and that through your support, we can look forward to addressing in more significant ways the unmet healthcare needs in the communities we serve. I also want to share with you that while we have been leading an extraordinary effort to protect the most vulnerable and disenfranchised by providing COVID-19 testing and vaccines and treatment, we have also been focused on advancing our strategic initiatives at Affinia Healthcare. These move the needle toward more widespread positive healthcare outcomes in our communities and decreased health disparities. To these ends, we regularly seek support from numerous sources, including federal and local grants and appropriations, corporate support, and private donations. We are extremely grateful and proud to be the recipient of substantial financial supports in 2022 and 2023 that are helping us pave the way for our construction of a new health center in North St. Louis County and expansion of facilities and services at 3 other locations. These developments are important steps toward the endless vision to address the unmet health needs in our community. The COVID-19 pandemic has taught us all that when the needs of some go unmet, the entire community is impacted. Affinia Healthcare was the first organization to provide COVID-19 testing and has continued to lead the way, providing the highest number of COVID-19 tests, vaccines, and treatment in the vulnerable primary service areas we serve. If not for Affinia Healthcare's leadership in providing access within the neighborhoods where people live, their churches and parking lots, storefronts, parks, public housing areas, and hundreds of locations in collaboration with as many community partners, we may be looking at a higher toll of hospitalizations and death from COVID-19. This cannot be understated as our staff, our healthcare superheroes, have been working tirelessly to keep at bay the toll of COVID-19 hospitalizations and deaths and lessen its impact on healthcare disparities that already exist. This is a pivotal time in our history, as today, more than ever before, our patients and communities look to Affinia Healthcare for leadership in meeting the medical, dental, and behavioral health needs of those most in need in our organization and in our region. This charge is an honor and a responsibility we are prepared for and we do undertake each and every day. On behalf of our 43,000 patients and the many more that stand to benefit from your generosity in years to come, I thank you again for joining us today and for your support of our mission. Thank you.
Wow. Thank you, Dr. Freeman. My goodness. I hope you were struck, because I certainly was, by a few of the things that he said and the words that he used to help bring those ideas home. An enormous challenge, a lack of access, poor outcomes, disparities. Now, at the beginning of the evening, I did not introduce myself to you, so let me do that right now. My name is Rennie Knott. I am one of the morning co-anchors of Today in St. Louis here in the city of St. Louis, and man, I love being here. I used to do sports, but now I do the news. It's something that I learned over the past 2.5, 3 years, is that we really need to help one another out, that we all are indeed in this together. And one of the heartbreaking things about COVID-19 in the St. Louis community is that there was an entire community that was lost, an entire community that seemed forgotten. Had it not been for Affinity, had it not been for the Urban League, Had it not been for people understanding that there is a need in our community that needs to be fulfilled, those people may not be with us today. Because on that side of town, as we are going to tell you later, is some of the poorest sides of towns in the state of Missouri. Those people need our help. They need our support. I know it's been said that I am not my brother's keeper, but I'm going to tell you something. In 2022, we need to look out for our brothers and our sisters. Strangers, people we may not ever come in contact with. We need to let them know that, yes, this is America, and in America, we take care of one another. In America, we make sure that you could be on the path. In America, we make sure that you're healthy. Man, it seems like such a simple thing to think, oh, wake up in the morning, take a couple of aspirin and get going. But do you realize that there are people in our community that have to make a choice? Pay rent, eat, feed my kids, or get my medications every single day. And these are choices that are life choices, live or die almost. But tonight we're going to make a difference. Tonight we're going to make sure that those people know that they are not forgotten. Tonight we're going to make sure those people know that they can indeed achieve the American dream, because we're going to help them stay healthy, to stay on that path. I hope you guys are with me. Man, I hope you guys are with me. I wish you were in the room with me tonight so I could feel that energy, because I'm going to do my best to give that energy back to you. Even though we're far, we're still near. Now, as he said, this is a pivotal time. Sorry about that. And as those in our community look to Affinia Healthcare for leadership, we are turning to you tonight for your support. I do that with hands like this because I want you to answer my prayers. There is still time to purchase a raffle ticket, or 2 or 3 or 4, however many you want. Also, get your hands on a golden ticket for that chance to win that 1-week Mexico getaway. We are posting the link in the chat window right now as I speak, so you can also find it in the electronic program that you received this evening. I am so fortunate to be with you tonight and to have with me here the Executive Vice President of Affinia Healthcare Foundation, Mrs. Yvonne Bullinger. Man, she is a powerful woman. She is my co-host this evening. Yvonne is here with me, and she would like to take a few moments right now to recognize our sponsors and our donors. Ladies and gentlemen, please welcome Yvonne.
Thank you so much, Rennie, for that wonderful introduction and for being here with us tonight. We are honored to have you as a host and MC. Due to the impact of COVID-19 and out of an abundance of caution, we moved the gala not once, not twice, but 3 times, and decided that rather than postponing again, we would come to you virtually. We look forward to the opportunity to meet with all of you again at a face-to-face event where we can come together in person in support of Affinia Healthcare and the Affinia Healthcare Foundation and the tens of thousands in the communities that we serve. Our mission is stronger because of your generous support. I want to take a moment to recognize our sponsors and our supporters this evening. Tonight's platinum sponsor is Liuna. Our gold level sponsor is Mallinckrodt Pharmaceuticals. At the silver level, we would like to thank ATSU Missouri School of Dentistry and Oral Health, Arcturus Design Collaborative, BKD CPAs and Advisors, Mutual of America, SSM Health, and Washington University School of Medicine, Department of Obstetrics and Gynecology. At the bronze level, we are so pleased to have the support of Cape Sokol Attorneys at Law, Good RX, Home State Health, Logan University College of Chiropractic and Health Sciences, Quest Diagnostic, the St. Louis Regional Health Commission, Wall Street Group Advisors LLC, and Washington University School of Medicine, Department of Education. At the copper level, we thank St. Louis Children's Hospital. At the leadership level, we are so grateful for the support of Joan DeAmbrose and Linda Dettering, Brian Fabiano, Dr. Alan and Deanna Freeman, and Dr. Melissa Tepe and Michael McFarlane. We are also so grateful for our patron level sponsors: Ronald Buehlinger, Dr. John and Michelle Constantino, and Sheila Greenbaum. We also would like to take a moment to thank our wonderful in-kind donors who are listed in the electronic event program you received this evening. Thank you for your generosity and your endless vision.
We do have a few people in the room, so all the folks in the room, they'll put their hands together from time to time. I'll tell you something, Yvonne may not be the largest person in the room. In fact, she's really about this tall. She's got heels on tonight. But she's a very powerful woman because she has that endless vision. And without leadership like people like herself, I wouldn't be here tonight. We wouldn't be here tonight. But they are here to make sure you're here. And together, we're going to make a difference. Once again, thank you so much, Yvonne. And thank you for all the sponsors that you're able to bring in and to support for such a very important evening. As you have learned tonight, the Affinia Healthcare Foundation exists to raise funds and awareness in support of the mission of Affinia Healthcare. They do this by helping to secure financial resources necessary to address the unmet healthcare needs in the St. Louis region. I want you to consider this. In 2021, Affinia Healthcare provided clinical services to 39,544 individual patients. In addition, 34,400 COVID-19 tests were provided and over 23,670 COVID-19 vaccines. Folks, that is an endless vision indeed. It's a lot of people too. A quick reminder that each of you had the opportunity tonight to make an impact in our community with your support. Raffle tickets and those golden tickets are still available and will be available until 6:15 this evening. We are posting the link in the chat window for all of you to see, or you can find it in the electronic program that you received earlier. Now, let us take a moment to talk about why we are here tonight. This is really important. I want you to listen up. 94% of Affinia Healthcare's patients have incomes below 100% of the federal poverty level. 94%. Let that sink in for a moment. 94%. That means if I had 100 people, only 6 of them are above that level. 43% of Affinia Healthcare's patients are uninsured. Nearly half. Imagine a life where healthcare was not accessible because you lacked the financial resources that were necessary. Most of us here tonight probably can't imagine that, but it does exist in America in 2022. Affinia Healthcare serves more than 3,300 unhoused individuals each year, which is the second most of any grant-funded entity in St. Louis. 3,300 people without a home, without a roof over their head, without heat, without electricity, without the coolness in the summertime. Now, there are a couple of area codes in the Affinia Healthcare Service area, 36106 and 36107. They are among the 5 poorest in all of Missouri, not just here in St. Louis, but all of Missouri, everybody. So tonight, we turn to you, our trusted partners and supporters whose care and compassion for those served by Affinia Healthcare can obtain the care that they need, the care that they deserve, the care that they deserve.
Healthcare disparities in the U.S. are affected by social and physical environments at multiple levels and are relevant to understanding and addressing disparities across racial or ethnic and socioeconomic groups.
There are differences that exist in our population, and our vulnerable individuals from different ethnicities and ages, backgrounds, different lifestyle choices, and different ways in which we live and experience. They do not have access to the same level and often the same quality of service as other individuals who are more affluential.
Where we are in St. Louis, it is a very highly segregated community, and there's a vast distinction between the haves and the have-nots. And unfortunately, we have a very high poverty level in St. Louis, and with that poverty comes health disparities such as asthma, cancer, and now, as we see now with COVID-19, with African Americans and people of color being really disproportionately impacted by COVID-19. And it's really related to just social determinants of health. So lack of access to quality health care, education, employment, even transportation. So Affinia Healthcare, we're working to eliminate some of those barriers and to get people on the right track to health equity.
Addressing healthcare disparities is a core component of improving our nation's overall health, reducing unnecessary healthcare costs, and achieving health equity.
Health equity, simply stated, is health that is equal for all. It is not different for another, regardless of where it's provided or how it's provided or what our life's experiences are. Equity means it's the same. Of course, it has to be funded, and it has to be funded properly and effectively. There have to be organizations, providers, clinicians, support staff who have an interest to provide compassionate and exceptional care in communities that are in a vulnerable state. And we also have to be culturally proficient. We want to assure that people from all walks of life recognize that they are welcome in our doors and that we are going to care for them in the very best way we possibly can. We're going to be non-judgmental, and we're going to assure that our mission of providing high-quality health care and exceptional service to all who walk through the doors is met with each and every exchange.
In many communities of color, there is a huge distrust in the medical system. In order for us to really make an impact, we have to first decrease that lack of trust that individuals have in the healthcare system. We can have access to healthcare, but if individuals are distrustful, they're not going to seek and obtain that healthcare.
Community health centers like Affinia Healthcare provide affordable, comprehensive care close to home. I'm grateful for everything their workers have done and continue to do to bring quality care to more people, especially those in underserved communities.
Affinia Healthcare is a leader in addressing health disparities in vulnerable populations in the St. Louis area. By expanding their exceptional services, they address dire unmet healthcare needs in the communities they serve.
Through the services of about 400 individuals, we provide primary medical, dental, behavioral health, enabling services such as WIC and community health. We serve roughly 43,000 unique patients each year. 90% of those patients have household incomes under 100% of the federal poverty level, and about 40% are uninsured, another 40% covered by the state Medicaid program.
The Affinia Healthcare Foundation was launched in 2018 to support the strategic initiatives of Affinia Healthcare in order to secure financial resources to address unmet healthcare needs in our community.
There are so many unmet needs in the community, and we are endeavoring to reach out to what I would say, quote unquote, are the deeper pockets in the philanthropic community and in the business community, to help them to understand just how much greater the need is than the current capacity is to meet it.
It's organizations like this that take on healthcare challenges in some of the most challenged environments that draw a great deal of attention. The demands on them for all sorts of things have been significant, and it's been completely impressive to see them use the limited resources they have to affect the directly problematic folks that live in communities that we all are in each and every day. They are limited in what they can do by the government funds that come their way. And if we want to make sure that we are improving and moving forward, it's proven organizations like this that need individuals and groups to help them through this foundation so that as they chart a path for the future, it's a brighter path for this community.
Our hope is that with our strategic initiatives, we could make very deep changes in the community with the help of everyone who also believes that healthcare is a human right and everyone deserves access.
To support Affinia Healthcare Foundation and their goal to address unmet healthcare needs, visit affiniahealthcare.org/donate.
All right, everybody, I hope the message is settling down into your bones and is sinking into your heart, because now it is time to talk about the reason we are here. Now is the time to work up that support. Now, I don't know about you, but I am so inspired by the work that is being done by this amazing organization. Work that benefits so many people in need, all right here inside the St. Louis community. And don't you just love St. Louis? Don't you just love the idea that we can support one another so that we all can do something for the greater good? That it's not just about you, it's not just about me, it's not just about us, it's about all of us. All of us. And all of us together could rise up tonight and give what we can. Give what we can to make a difference for those who really need us. Who need us not just financially, but need us to be there to show them the love and the support. I hope you're with me tonight, because we're going to do this. We are going to do this. Are you with me? I hope you're all screaming at home, because, I really can't hear you, but I like to do this anyway to make it seem like I can hear you. So let's get to work, and let me tell you how this is going to work. On the screen, you will see a funding level. You will hear me talk about the impact, the services that funding at that level will provide to a community that deserves it. Each of you were assigned a bidder number. When you find a level that you would like to give at, I want you to enter that bidder number into the chat window, and a member of our team will record that number. And then on Monday, you will receive an email with a link to complete your donation. All right, folks, I hope you're ready. And I said that we're going to have different levels here, and I want you to make sure that you get a level that you're comfortable with. I actually want you to make yourself a tad bit uncomfortable, because there's somebody out there tonight who is extremely uncomfortable, does not know not just what tomorrow may bring, in many ways doesn't know what the next hour may bring. There might be a knock at the door. There might be a sneeze in the room. There might be a cough that changes their world dramatically. So if their world is just inching by, I need your world to be just a little bit uncomfortable tonight. So let us start now with our very first level. That first level is $2,500. As you will see in your program and on the screen above me, $2,500 will provide a monthly behavioral health visits for 1 year for an uninsured child. A complete set of dentures and related visits for 2 uninsured adults. Medical visits for 12 uninsured patients for a year. For a year. So right now we're going to take care of people who need to have their teeth taken care of, because oral health is the key to body health. We're going to take care of a child out there who's having some behavioral issues and a family that is struggling with it. We want to make sure that that child is being taken care of, because that child is here because he's here. Not because he wanted to be here, but because he is here. Let's make sure that child is well taken care of. How are we doing out there? $2,500. That is our first level tonight. Anybody ready to give $2,500? Let us make an impact. We're talking about making a difference in the lives of people for an entire year. 365 days, that's a long stretch. That's a long stretch for someone to go without any health care in their lives. This is a chance to make a difference. Our next level now, wait a minute. Hold the phone. I just found out that we've got somebody in at $2,500. Want to say thank you to 9762. 9762, thank you so much. We greatly appreciate you so much tonight. The reason why I had to take my glasses off and give you guys an idea what's going on here. I'm in a room. These glasses here help me see the prompter. Can't help me see in the back of the room, a whiteboard with numbers on it. So I have to take it off and strain my old man eyes, but they still work somewhat to this point. I still need the glasses though, so thank you very much at our $2,500 level. Our next level is $1,000. $1,000 level now. Let me tell you what $1,000 can do. As you just learned, wait a minute, what is this? We just found out that we have a matching gift tonight. A matching gift. So before I run through what $1,000 will do, we have a matching gift of $5,000 from Mitch and Linda Barris. All donations at that levels will be matched to $5,000. So what we need now is at least 5 people to jump on board, donate $1,000, multiply that by 2, and we're really going to make $10,000 tonight. Let's make this happen, folks. Let's make this happen. $1,000 can provide comprehensive medical and dental health for one adult. That patient for 1 year. Medical visits without vaccines for one newborn for the first year. Behavioral health visits for 6 months to a child diagnosed with attention deficit disorder. All right, so we're looking for at least 5 people to come through with us tonight with a $1,000 donation. That is going to be matched, and when that match comes through, we're talking about $10,000. Okay, right now, 1333, want to hear for 1333. And for 1036. So we've got 2 so far at $1,000. Who else wants to jump in and be a part of something special tonight? A $10,000 impact in a very short amount of time. Right now, we see some more. Come on, keep it coming, keep it coming. All right, let's go down to our next level now. $500. $500 can help us provide dental visits for 1 year for one patient. 1 month of opioid substance abuse treatment for a patient. A prenatal visit with lab testing and ultrasound for one uninsured pregnant woman. Who would like to jump on board right now and give tonight at the $500 level? Anyone tonight ready to do $500? Think of me as your coach, folks. Think of me as the coach. What I want you to do is put on the pads. I want you to take the ball. I want you to punch it across the goal line tonight. $500 will give us the end zone. It'll have us in there dancing. You might remember, White Shoes Johnson used to kind of do this. Well, okay, it's a long time ago it happened. But what I'm saying is we want to celebrate tonight. We want to celebrate the giving. All right, I've got number 1402 and number 1420 giving at the $500 level. Thank you so much. Thank you so much. Anybody else want to get on board at $500? Let's keep this going. I've got... We will match. We will match. You again, I said, my eyes. Oh, these eyes. Yes, these eyes can barely see the whiteboard in the back of the room, but I understand that we will match. So with that being said, a round of applause for everybody at home, everybody that's giving. As I said, we've got numbers for everybody tonight. And we really do need your help because we want to know that we are making a difference in the community that we serve. To the people who deserve to be served, to the people who are looking for a little bit of help. All right, we're doing great. We are doing great. Everybody's happy. Yvonne's over there. She hasn't taken her shoes off. She's got high heels on. She's excited. She's enthusiastic. She's like, man, what a night. And we're just virtual. Imagine if we were all together. Whoo, we would have done gangbusters. All right, let's keep this momentum going right now. Let's see what more we can do. Let's talk about our next level. That level is $350. Now, most of us probably spend that much in a month just driving through Starbucks, getting a cup of coffee, something to peel the eyes back. Well, now's a chance to do something for someone else with that $350. $350 can provide 1 month of insulin and supplies for a diabetic patient. Hepatitis B series vaccines for 3 patients. Preventative dental visits and dental sealants for an uninsured child. $350. That's all it takes. Let's see those paddles in the air. Light up my board. Over here, I have a young lady who's basically working the chat room. She's doing everything she can. And trust me, she's working furiously. But I really would like to see her working so hard she can't keep track. So if you can, give. We're looking for $350 right now. $350 making the difference. Risa Rollins and Yvonne jumping in at $350. Yvonne's right next to me. I had no clue. I just thought she's waving and saying hi to the folks behind the camera, trying to keep everything just culture and nice in here, making sure that we're communicating with one another. Thank you, Yvonne. That's very nice. You're the only person I could talk to in the room that can actually talk back. She's the only other person who's mic'd. That is why we can do that. All right, now, have you found a level that speaks to you? Have you found something that you said, you know what, I can do this. It's in my heart to make a difference. This is my opportunity to do just that. Now, maybe our next level is the level that is for you. I'm talking about $175. $175. Let's get this done. Let's get him board. Let's do this. $175 can supply one diagnostic mental health visit for a child, language interpretation for 2 dental visits, asthma medication for an uninsured child for 1 month, 3 pairs of eyeglasses for uninsured children. Who here tonight can make a difference at $175? And I'm going to tell you this. I'm 57 years old, but I grew up with asthma. And I know how tough it could be to breathe, how it takes you out of doing the simple things in life, like playing with your friends. Let's make sure that kid can do that. And as you can see right now, as a 57-year-old man, I wear glasses. Right now, there are uninsured children in the St. Louis area that can't see properly, can't do their schoolwork, can't focus because they can't see properly. Let's help them out. I've got some numbers coming in now. $13.99, thank you very much. $13.24, $15.01, $13.93. Thank you very much. That second set of hands clapping, that's Yvonne over there. She's pumped tonight. She's pumped. $13.72 as well. Yes, yes. Maybe the $50 level is the level that speaks to you. For $50, just $50, we could provide one podiatry visit for an uninsured patient. We can also do some other things like a PSA testing to screen for prostate cancer in 10 men. 10 men, that's 2 basketball teams. Or perhaps 2 prescription medications for a homeless patient, someone who really, really needs our help. Anyone tonight able to donate at the $50 level. Anyone tonight able to do $50. It doesn't seem like a lot, but you know what? Those little bits add up to become a lot. $50 can make a huge difference for so many people right now. All right, $14.47, thank you very much. $13.09, thank you very much. Chip, you the man, Chip. He's right over here, by the way. Chip's got the headphones on, so I know he can hear me because the mic goes right through his ears. Allison, thank you so much for jumping in. Yes, yes. Oh, there's more. I'm told there's more, which means, Rennie, you just keep jabbering away and we'll write this down and then I'll give you those numbers so you guys can start jumping up and down and oh. No, truly, guys, I am so excited to be here. Number 13, is that a 0 with that 9 or a 6 with that 9? 1309. 1309, 1321, 1024, 7771. Thank you. Thank you. Oh, man. This is tremendous. This is tremendous. Wait a minute. She's wiping down the whiteboard again because the whiteboard's pretty big, but she's got to write the numbers really large because, well, I can't see them. It sort of helps me be able to relay back to you all the good that you guys are doing. Number 1270. Thank you very much. 1432, 1195. Thank you. Thank you. Thank you. Thank you. You know, we talk so much about giving. And it is hard for us to give because in many ways, a lot of us don't know what tomorrow could bring. We don't know if our car could break down or our kids need help or anything like that. So give what you can and make sure that you have enough for yourself too. I'm sorry that earlier I said feel a little bit uncomfortable, but I do want you to stretch what you can to the nth degree to make that difference. Number 8887, number 1276, 1321. Thank you, guys. Thank you. I tell you, that $50 level is just buzzing right now. Everybody's into that one. That was so good. Thank you so much. I'm gonna tell you guys, wow, what a great show of support we just had there. That's tremendous. You guys should be so proud of what you have done tonight. For the lives, so many lives that you have transformed because of your generosity and your support. Thank you, thank you, thank you. Now, please, welcome back to the stage, my co-host, the one, the only, and I just use her first name because her last name is about this long, Yvonne. Yvonne?
Well, thank you so much, Rennie. And thanks to each of you for your generous support this evening. You're amazing. Thank you.
Thank you, Yvonne. You are amazing, truly, truly amazing. As I said earlier, she's not the tallest person in the world, but when she speaks, she makes a difference. What she has in her heart is changing the landscape in St. Louis, making sure that those folks out there are not forgotten. Thank you.
Thank you, Rennie.
Thank you, because a lot of those folks
Your
are people in my
heart
community.
is amazing too.
Well, I appreciate
we
that.
really
Thank
appreciate
you.
your support.
Thank you. Now I'm blushing. I'm blushing. No, I'm not. Well, I am blushing. You just can't tell. Those are my inside jokes I give her once in a while. I'm just trying to make the two guys behind the camera laugh. That's all I'm trying to do right now. They have been great. They have done so much to make this night happen. And what a fabulous night it has been. You guys have just been absolutely amazing. And now it's time for us to help give back to you for what you're able to do tonight, because now is the time to draw those raffle winners. Man, ooh boy, Yvonne is back now because I'm going to put all the pressure on her. Now, it has been my honor to serve as your MC tonight. It has been incredible. But before we close out tonight, I want you to know that there's a tiny bit of housekeeping that I do need to do before I say goodbye. And then we'll do the drawings, okay? First of all, if you donated during the Fund a Need raffle, you will receive an email on Monday with the instructions on completing your donation. Second, if you would like to talk with someone about your donation or other ways in which you can support the Affinia Healthcare Foundation, you can contact Yvonne right here. You can do so directly. Her email and her phone numbers can be found in the chat window as I speak and in your electronic programs. Now, the moment you've been waiting for. It is time to draw the winners. First up, the wine raffle. Now, this is a $35 ticket, and the wine basket is valued at $400, actually more than $400. Go ahead, shake it up, and pull. There she goes. She's not looking. There you go. All right, here we go. Let's see if Rennie can read this. Oh, two there. I didn't see either one. Oh, and it's upside down too. That really helps. Ladies and gentlemen, John Campbell, come on down. You are the winner of the wine raffle tonight. John Campbell, congratulations. Now it's time for the golf raffle. This is a $30 ticket to win. Uh-oh. You okay with it? Just checking to make sure. Uh-oh. We've got a little technical difficulty there. I want to make sure our microphones are ready to go. John Campbell, you did indeed win the wine raffle. Oh, it's my microphone. Get a new microphone. Hold on. You got me okay? All right, shit. Hold on. Oh, it's went red, which means the battery's probably dead. Here, I'll just take it like that. No, let's do it like that. This happens in television all the time, too. But that's okay. We know how to make it work. There we go. There we go. Okay, now we're going to go to that golf prize. This is a $30 ticket to win an exclusive golf outing for you and two guests alongside Mitch Barris at Meadowbrook Country Club. The winner is... It was John Campbell again, I'm telling you. Oh, glasses off and upside down. Why do I keep doing that?
Daniel Hahn.
Daniel Aron? Hahn? Daniel Hahn. Daniel Hahn, you are tonight's winner. Congratulations. Enjoy the golf. Just yell 4, because, there's houses along the fairway. Our next drawing is the attendance drawing. This is a $25 ticket to win 4, count on 4 exciting items. A Cardinals basket.
We're doing 4 drawings.
Oh, we're doing 4 drawings. The first drawing is for the Cardinals basket. Here we go. I get ahead of myself sometimes. Here we go. Okay. And this is John Campbell. John Campbell, you get the Cardinals basket. Now our Blues basket. If it's John Campbell again, I'm coming over his house. Have him buy some lottery tickets for me. Ralph Jost. Ralph Jost. Now for the Kendra Scott jewelry. Kendra Scott jewelry. That is going to be Kelly. Kelly L. You know who you are. We know who you are too. And now a basket of St. Louis, the best of St. Louis. And the winner is, oops, again, upside down. What is wrong with me? Michelle?
Michelle Rademski.
Ah, Michelle, how you say her name again?
Rademski.
Rademski. She should play hockey with a name like that. Rademski. I love it. Congratulations. Congratulations. I know. It's been a long day. This is what happens when I've been punch drunk. I used to wake up at midnight, so this time of the day I tend to get a little silly. And now for our final drawing of the night, and I am told you do not need to be present to win this one. It is that trip to Mexico. It is the Golden Ticket Raffle. This is huge. Deep breath. Deep breath. Here we go. Everybody's on pins and needles, leaning all the way over the couch. Here we go. Catherine Moore. Catherine Moore. Congratulations. You get to go to Mexico. If you need an escort, you can always find me at Channel 5. Just email me. I'll go right there with you. I want to say thank you so much tonight for joining us. On a serious note, we greatly appreciate your generosity and your continued support of Affinia Healthcare and the Affinia Healthcare Foundation. You have helped so many lives across our area, help them become healthy, help them become just a little bit more self-efficient so they can move forward in chasing that American dream. Good night, everybody. Enjoy your weekend. It has been my pleasure and my blessing to be with you tonight.